who passed away en route to the hospital, and the test done posthumously showed to be positive. The third case was a Gambian man in his 70s who recently returned from France and was diagnosed on the 23rd March 2020. He is currently on admission and undergoing treatment. One of the close contacts of the second case, that's the late Bangladeshi man who is on quarantine currently, was tested, and his test is inconclusive as we speak, and it is being repeated, and you will know as and when the test comes up. He's a Bangladeshi man who is said to be in his 40s, and he came to the Gambia with the second case who passed away. He is among the 10 close contacts tested yesterday, 24th March 2020. All others who were tested together with him were negative. The contact tracing is continuing aggressively. We request that anyone who has had contact with the Bangladeshi team or has visited the Markaz Center from the 17th to the 23rd March 2020, both dates inclusive, to call our toll-free number 1025 for further advice for necessary action to protect themselves, their families, and members of the community at large. Currently, we have 177 people on quarantine in various hotels, as they are all safe, and sound. In 6 days, the first batch will be out of quarantine if they continue to have no symptoms. 4 of our staff are amongst those being quarantined because of their possible exposure to the second case. We thank them for their immense hard work and sacrifice for the people of this country. We wish to tell them that our hearts and minds are with them, and we wish them all the best. We wish to thank all our health professionals and other supporting partners who are constantly sacrificing on the front lines for the control of this disease in the country. Our sincere appreciations also go to the security personnel who have also been going through the risk of supporting us. We urge all people living in the country to adhere strictly to the advice of the Ministry of Health and the government of the Gambia in the control of this disease. COVID-19 is not a joke, and we should all take it very, very seriously to make sure that it doesn't spread in the country. Once again, thank you very much for your attention. Our sincere gratitude also go to the men and women of the media who are all the time with us. Come rain, come shine, they are there, patiently waiting to disseminate the information for the people of this country to be aware of what is happening and also to take much precautions. We equally advise the men and women of the media to also take the necessary precautions all the time, because that is also essential to protect all of yourselves. Once again, thank you very much.
Thank you very much, Honorable Minister, for that explicit statement. Perhaps we will now allow 2 or 3 questions. I've been known very well that he's quite a busy somebody. If there are possible questions that will be asked, with your name and the media house that you represent, and we will give you the floor. Okay. Yes?
I'm Salif Wanja, the GTTV, that's Gambia Talents Promotion. Mr. Minister, a state health ministry that lacks a lab or research center to test COVID-19 cases instead of solely depending on private institutions like MRC, also jeopardizing that of all the citizens by setting up quarantine centers in dense populated areas like that of the one we have at Golden Beach. Perhaps we have another one which we don't know exactly, which is probably existing in the midst of dense populated area too. Don't you think it is high time for you to actually tell the citizens of this country how serious is this government as far as COVID-19 is concerned?
Of course, you know the government is very serious as far as COVID-19 is concerned. You've seen all the steps that have been taken when this outbreak occurred in China, the sensitization, the press releases, the meetings, the mobilization, the discussions with the partners. In fact, I will tell you, and you should note that today, that Gambia's response has been more aggressive than a lot of countries in the sub-region since this outbreak started. Most of the things we started with, they started to do when they started having cases. So our response has been very, very aggressive, and this government takes the health of the people very seriously. You are talking about the lab. If you understand how these labs work, many of the countries have labs that are partnerships when it comes to infectious diseases. If you go to Senegal, they have the Pasteur Institute. That is not even purely government owned from what the information we got, even from the name. It's a partnership lab. The MRC lab belongs to the MRC, but they have been doing a lot of collaboration with the government of the Gambia. In fact, the trainings are collective training. MRC and Gambia government collaborate to do a lot of work. By the way, MRC is in the Gambia and they have facilities. So we interrelate and we use each other's facilities. MRC is in the Gambia. It is not in a foreign country. And it is in the Gambia to do what? To work for the Gambian people, not to work for any external partners. So we participate in using each other's resources. And some of the resources actually donated to the MRC are for the people of this country. But MRC's work here is for the people of this country, not for any other group. Now, the Gambia government has inherited a lab. The current government has inherited a lab. And that lab has recently been upgraded to what we call BL3. MRC's lab is a BL4. It talks about the biological safety levels. So the BL3 lab can equally do this test, and we are getting equipment, additional materials to be able to do the test in the Kotu lab, not just in the Kotu lab, in other centers in the country. But of course, you have known that even the people with the best of facilities are overwhelmed by this disease. So our steps are in the right direction, and we are building capacity. In fact, this is also an opportunity to build capacity across the length and breadth of this country. If you know what we are doing behind the scenes, we are procuring a lot of equipment for the health sector. All the major hospitals are going to be strengthened. All the major facilities, their labs are going to be strengthened. They are going to get a lot of diagnostic equipment, and we even want to decentralize the test so that tests are doable up country. So when patients go up country, they'll be tested rather than people moving from here over there. And people are being trained as to do those tests. Now, the Kotu lab will soon start functioning and doing the tests. We are working very hard on it. But you must know, in fact, there are still a lot of African countries who are unable to do these tests by themselves. So if you know the comparative facts, then it helps you very much to be able to relate to your current situation. Now, you talk about the quarantine in various areas. You should also know, I don't know if you know, but if you didn't, we'll let you know today, that when we were having this first group of passengers who came into the country, unfortunately, we got the information just 2 hours before the arrival of the flight. But we thought it was very important. Our people swung into action. They swung into action, and then that was very late at night. We were all up, including myself as a minister, 2, 3 a.m. We were all up communicating and making sure that they get somewhere to stay. Now, but unfortunately, most of the hotels did not want to accommodate them for the fear of the disease. So the hotel we got was the only one that was ready to accommodate these people initially. So as time went by, other people came in. So this was a challenge. Now, but if people are quarantined, they are expected to be indoors. And if they are indoors, you have all known we are talking about social isolation, but it's for a distance. If people get 2 meters, that's good apart. It could even be a little shorter than that, but we want it to be 2 meters. So if they are isolated in their rooms in the hotel, 2 meters, if that is in a densely populated area, I guess the densely populated area is much more than 2 meters away from this patient, isn't it? So the disease is not airborne, it's by droplets. So that distance is adequate.
Thank you very much, Honorable Minister. Do you have another person? If not, I allow him to give another. Okay, you come and then you come last, please, by virtue of time, or perhaps.
It's regarding exactly where he is right now.
Okay.
Because we are actually having escapees. That of the suspect, COVID-19 suspects. So that's the reason why I raised that question. The security of the citizenry. Because we understand that there isn't much security at those places. Because if there is, I'm sure there won't be any escapes.
Yeah, so we are equally concerned. In fact, people shouldn't have escaped in the first place. People should have been law-abiding. They should have done what they are supposed to do, because this is, this is what the law says. Under such circumstances, they should be quarantined. However, people being people, sometimes they do things that are not lawful. Now, the security is there, and I guess they are doing their best, but sometimes there are lapses here and there for these people to escape. I don't know how they escaped, but thereafter, the security has been beefed up again, because really, naturally, you don't expect people to escape. It's not a prison. So you expect people to understand and abide by the rules. So if they decide to escape, we were all surprised that people will run away from such a thing and escape, because we thought they'll be very concerned about their own welfare, about the welfare of their loved ones. They wouldn't go into the homes where their loved ones are. So it came as a surprise to all of us, but security has been beefed up, and we keep on continuing, and we also want to urge the general public. Government cannot do it alone. People have to play a role. Each and every one of us has a very important role to play in this endeavor. Now, just today, someone called that someone they saw in their community came from outside, and they expected the person to be quarantined, and is in their community. So they alerted us. So this is community participation, and we welcome that, and we want all the citizens of this country to do so. If you have someone in your community that you expect to be in quarantine, please let us know. Just today we got that information, and our people have gone to get the person. So this is good, and the quarantine is very important, because you can see when the case happened at the Marcus Mosque, the people were quarantined, and one of them is being closely watched now, and we will get those test results confirmed very soon, and we'll let the media know. So if that, assuming that individual were still in the community, could have been dangerous. So that's why we insist on the quarantine. And by and large, I think a lot of them understand now, and they are all participating, because they also want their loved ones to be protected.
Thank you very much, Honorable Minister. Can we have you, and then you become the last, please.
My name is Usman Jada from Paradise TV. What response do you have to these rumors going around on social media that, like, the third confirmed victim yesterday was claiming that he did not have the coronavirus? What response do you have for this other rumor that, like, there is a confirmed case at Brigham?
Starting with the first part of your question, sometimes in disease presentation, people could have denial. That happens when sometimes people are diagnosed of diseases because they would have thought the disease is too far away. They would have thought, no, this disease is not for them. Even the shock of just being told they have a disease that everybody is now talking about, people do tend to have denial, because there is no way he could have confirmed that he had the disease or not. The health professionals have the potential to do that, and which they did, and confirmed he has the disease. So probably he's in the denial phase. With regards to the one you are talking about, Brigham, I'm not aware, and we'll let you know if you get any information to that. Yeah.
Thank you very much. Can we have you, Ma?
My name is
Yeah, no, her hand was up well before her. If you don't mind, please.
No problem. No
Thank you.
problem.
Can you come up, please?
My name is Leso from Korean newspaper. Do you have a trained coronavirus medical team in each region? Do you have any ambulance in each region or border post to transport coronavirus suspect to medical facilities? Do you have protective gears to help officials at each border post or region?
Yes, so we have our team all over the country. You know, the health sector is such that we have regional teams. The Gambia is divided into 7 health regions. Each health region has a complete team, and each health region is headed by a regional director. So there is a team responsible for this, and they are working in very close collaboration with the central coordinating teams here. So there are people, public health officers are there, surveillance officers are there, epidemiology officers are there, and EPI officers are there, and so many other medical personnel are there. Now, with regards to the PPEs at each border post, yes, they all have PPEs, and we still have a lot of PPPs in stock, and a lot of PPPs are arriving into this country very, very soon. The Chinese embassy is donating some PPEs, WHO is donating, and then the Chinese philanthropist has also donated to the whole of Africa, and we are expecting those items here, including test kits, very soon in this country. Now, we have ambulances. We don't have ambulances at each border post. We have ambulances that can be called to go collect the people. However, we are working on procurement of ambulances during this our response phase, and the procurement process is ongoing. And inshallah, very soon we'll have a lot of ambulances plying these routes.
Thank you very much once again. Can we have the last person, please?
Yes, good afternoon. I am Aisha Bijala from Gambia Talents TV. But I would like to ask my question in Wolof for the benefit of our audience and to the people that read this question yesterday. We have one program called Lumajisi Banjo that is done by Pa Usman Duf in America. It was open line course. I'm not called a native of Bakau. Mu call mu ne guy then ñu don't play football. So ñu gis ku buga escape from the friendship hostel. Di génna guy approach ko bu ko laajte lu moo def mu ne dafa dem si bitik bi then notice ne kii xamul place bi moo tax muy laajte bitik. So si biir conversation bi si la wax ne moom mooy dafa bokkoon si ñu isolate from the maracas, bundun and stuff. So bu waxtaanee ba si biir mu ne dafa bugg a génna bu ko laajtee reason am muy génna mu ne moom dafa gëm ne am feebar bi. Why guys push and pull with him, but they could not touch him, they could not hold him, and then Buwahe Purmudelu, he used the other way around. God he is not certain, definite description, Lugor Bisol, Wana Lukokunundru and the age. So Luno Latemoy, is the ministry aware of this? And if yes, what measures are you taking cases like that? And the second one, also another caller, dafa call mu ne dafa dem in a private clinic. So in that clinic, they have the WHO questionnaire that is Nefo Jogi and stuff, where are you, whether you come from any country that is affected. So Bulate a lady, she answered all yes. Boom answered everything yes. The lady herself believed that she's already positive. And the clinic, what they have for her was, go back home, I'm not anywhere to get you here, and Carnifin is full, Banjul is full, and other public hospitals are. So do you have anything to handle them?
Okay.
Yes, thank you.
Yeah. Okay. Mangla wax jërëjëf. Sa explanation bi def nga ko yëpp si wolof, wante question bi yëpp si angale la ñëwee. So wante man dinaa try wax ko si wolof. Ku ngeen gisoon ku gaay gisoon si stadium bi yëguñ si dara, man yëguma ko. Wante xëj na suma gaay yëg nañ ko, wante suñ ko yëgee dinañ ko delloo foofu noonu. Wante loolu su dee am na lu mu ñëw woon rek mooy ñu beef of security foofu. Waate dinañ def loolu. so suñ amee façon yooyu gars yi nuñ ko defee moo gën because suñ de waruñoo dem si confrontation ak kooku wante mënoon nañoo call 1025 1025 mun nga koo call pour lu nekk si affaire yi Covid 19 mun nañ koo call suñ kooloon loolu te loolu duñ si fay dara toll free number la suñ kooloon loolu rek alaat suñ gaay nañ fa daw dem jëli ko wante foog naa façon lii laa doon waxoon si affaire yi information public bi suñ amee information rek na ko suñ gaay yegg suñ ko yegee rek nañ si am action système bi perfectut am nañ challenges wante for example kooku war naa xam ne warut a génna wante am na ñoo xam ne nag duñ dee faale yooyu suñ amee problème sax si lañ dee gën a lifin wante dinañ bii for security su dee loolu am na fàtte naa sa ñaareel question
ñaareel bi mooy jigéen bu dem si clinique bi
Yeah.
si boppam mu ngi génn si société
Yes.
hospital bi have to recommend that go back.
ok so loolu tamit su dee hospital bi loolu la def corrected wante xam nga hospital yi tamit ay nit a fa nekk nekkul ne luñ dee def all the time si place yi def dee corrected waruñoo def loolu dañ ko waroon a dimbale ñu ala team bi wante su dee loolu am na dinañ si wax ba pare suñ gaay ñu nekk si central level yi dañ dee liggéey ak ñu nekk si private clinic yi so ñoom yëpp a dee liggéey private clinic yi xam nañ lu ñu war a def bonte it's a continuous process xëy na kuñ fa fekka xaw ma lu tax mu def loolu wante suñ munee am turi place bi dinañ lañ sensitise pour ñu defati loolu wante ku la wax loolu tamit su amee façon information boobu rek na call 1025 suñ gars yi dañ fa dee nekka 24.
Thank you very much, and that is the Minister for Health there, Dr. Ahmad Lamin Samate, updating the media on the current, of course, situation of the coronavirus live from the capital, Banjul. And of course, our team is on the ground following proceedings. We will be going live, of course, to hear from our main man, Ibrahim Presba, on the ground to tell us more about on the highlight of today's press conference after the minister came before the press to update the public and, of course, through the media on the current situation of the coronavirus in the Gambia. And like I said, of course, it has been a day where there has been so many speculations and rumors and all that, but finally we heard from the minister himself, who is responsible of health matters in the country. And of course, you know, yes, the venue has been changed, but he have managed to come before the press and, of course, explain before the you know, the press and explain the situation on the ground. Like I said, in a moment we go back to the Banjul and speak to our man on the ground, Ibrahim Presba, and yeah, we will continue updating you as we have been doing over the past couple of days, like I said. So yeah, the situation you know, of course, is turned out to be a big concern for many Gambians and all that. Many have been calling for different you know, issues or have been raising different concerns. In fact, I should say for the government to beef up their you know, state of preparedness to face the coronavirus disease. And you heard from the minister talking about the challenges they are also confronting at their own level. You know, so it will be good if we can now, of course, any moment from now, like I said, hear from our man on the ground, Ibrahim Prespa, so we can, of course, widely discuss on the updates, of course, from the Minister of Health and Social Welfare of the Gambia. It's all about the coronavirus issue, you know, update in the Gambia. Because, like I said, Gambians are so much concerned, especially after, you know, the third case was confirmed in the farthest side of the country, in the Upper River region. So It's daily updates, and it started on Monday, and of course every day during the week, and of course to the weekends on Friday and Saturday, of course the minister would give updates daily on the state of the country's preparedness, but equally on the situation of the disease in the country, the number of cases, the number of quarantined people, the people that have been traced, and all that, and of course the people that have also contacted, or the number of contact cases also would be of course be discussed during the meeting with the press, so that the public will be very much informed and of course aware about also the level of preparedness of government, to make sure that they would make sure